It may seem a little crazy, pretty baby, but I promise.
Let's get into it. I know y'all back. Okay, today we're going to be talking about a little detailed explanation of sinusitis and rhinitis. You got service connected, but you don't know why you're at 0% or 10% at that matter. Tune in. We go deep dive into this. Find out specifically what the VA is looking for and how you can get those percentages. Let's get into it. All right. So first of all, with rhinitis, there's 3 different versions of it. You need to identify which diagnostic code the VA is giving you, because there's allergic rhinitis. There's all right. So we got allergic rhinitis, we got bacterial rhinitis, and we got granulomatous rhinitis. Now with the first 2, you can get anywhere from 10 to 30 or 10 and 50%. There is no in between, as well as a 0%. For the last one, for granulomatous, anywhere from 20, you can get 20% or 100%, depending on the severity. Now, when it comes to getting 30% or 50% for allergic or bacterial rhinitis, this is what the VA is looking for. We're looking for nasal blockages. And the way, they identify this with, polyps or whatever the hell. But mainly they're looking for is nasal blockages, either in one nostril or both nostrils. You can capture this by going to your ear, nose, and throat doctor and requesting either a CAT scan or a nasal endoscopy. The nasal endoscopy is going to put a camera in your nostrils, in your nasal cavity. It's going to take pictures and it's going to measure blocked, as well as what's the severity, and what's the growth of it. Whenever you're experiencing, and they're going to measure this. And the only way you can get a diagnosis of rhinitis with nasal polyps or nasal obstruction is through the use of a CAT scan or a nasal endoscopy. Yes, you can exhibit signs and symptoms of it. However, the same goes for sinusitis. Your best bet is to request a nasal endoscopy or a CAT scan, because that's going to give you reach towards the 50, the 30%, and the 100% possibly, depending on your severity on rhinitis. Now, whenever you go into your doctor, you're definitely going to need to go into detail, either in your personal statement or in your complaints to your doctor. Like, they're looking for what are the triggers after you've received the diagnosis. Prior to even getting a CAT scan or a nasal endoscopy ordered for you, the doctor's, the ear, nose, and throat doctor, they're going to want to see what are some triggers. Is it being triggered by incense, tobacco smoke, aspirin, chemical fumes, dust or debris, cut grass, things of this nature. Some people, they're allergic to grass. I don't know, but come on. And one thing to keep of note, rhinitis is a swelling in the nasal area. Sinusitis is swelling in the sinuses. So whenever you do your complaints, whenever you get treatment, everything like that, you submit your claim to the VA, and you're definitely going to need a diagnosis for both. You just can't go in, submit a claim, even though it's Pact Act Presumptive, the VA is not going to process you for both. They may lump it in together if you don't have separate diagnosis for each one, as well as treatment and medical history for both as well. You need to be able to differentiate the signs and symptoms of each one. Sinusitis is with the sinuses. Rhinitis is specifically with the nasal cavity. And testing criteria, ironclad evidence for sinusitis is going to be CAT scan or MRI, and severe cases, a biopsy. But a CAT scan and an MRI is going to show any issues, any issues going on, and specifically capture it's going to capture any structural issues with your sinuses. Not to confuse with your nasal cavity, but with your sinus issues. And it's going to capture all of this in an MRI. And the best time to go is during a flare-up. I know sinus issues usually last up to 12 weeks. Could be, less than that, but usually they last 12 weeks in duration. Maybe 3-4 times a year. But you need to document this. Don't try to muscle it through. Don't try to take all this medication and everything. No, when you're having a flare-up, get into a VA medical facility or your private doctor, ER, and request an MRI or a CAT scan for sinusitis, CAT scan or a nasal endoscopy for your rhinitis. This is going to be the best medical evidence you can gather to increase your, your percentage if you're at a 0 or even a 10%. If you're at a 10%, more than likely you've had severe cases. It may not have warranted enough for a MRI, CAT scan, or a nasal endoscopy. However, you have repeated issues with your sinusitis, or with your rhinitis. But in order to get ironclad evidence when you're having an episode, get into your doctor and request an MRI, CAT scan, or a nasal endoscopy in relation to if it's sinusitis or if it's rhinitis. Ah! All right, so we've already talked about all that. Some potential secondaries for either one, sinusitis or rhinitis: chronic headaches. It's it's one and the same. As long as you can differentiate, this is one of those disabilities you're going to need to be able to differentiate your migraines from any sinusitis or any rhinitis issues. The same with if you're trying to do, TBI secondary to PTSD, you're going to need to show that differentiation. Have a diagnosis for both, and your treating physician will need to be able to differentiate, okay, this is a TBI episode, this is a PTSD episode. The same with, okay, this is just sinusitis issues, this is just rhinitis issues, and it's causing, when they're not experiencing any symptoms of sinusitis or rhinitis, they're developing migraines, facial pain, tooth headaches, and stuff like that. Another secondary is asthma. Not most, but majority of people who have sinus issues, sinusitis or rhinitis, have other secondary respiratory issues, such as asthma or bronchitis. And another one that can be secondary to sinusitis or rhinitis is sleep apnea. You're definitely going to need a sleep study for it. Conduct your sleep study. If you have sleep apnea, you're going to be diagnosed with sleep apnea, severe to, from moderate to severe. Be issued a CPAP machine, and with the CPAP machine, you're going to need required use in order for the VA to get you, the higher percentage. But if you just want to be treated and service connected for sleep apnea, you definitely need to tailor your complaints. Actually, go into the doctor, complain either physically on the phone or through their online portal. My Healthy Vet, if you're going to the VA medical center, you need to complain about it. You just can't go into the VA and expect, hey, I want to claim this. Okay, why? A lot of veterans think that just because they're service connected for sleep apnea, that they can get, a 50% or 100% off the rip. No, you need to be able to develop, is it direct service or is it secondary connection? Secondary is if it's being caused by an already service-connected disability. Direct is if you're somewhat between, you're closer to your EAS or ETS, some branches cases, and your sleep apnea is mainly attributed to your active duty time. And once you gather all this medical evidence, and you start looking and evaluating yourself, become familiar with the CFR 38 as well as the M21-1 adjudication manual, you'll see what the VA examiner is looking for when you go into these CMP exams, compensation and pension exams, as well as once that exam and all your medical evidence has been submitted to that VA rater, VSR, what they're looking for specifically to get you service connected, first of all, in order to get you treated at a VA medical facility, as well as depending on what medical evidence that you supply, it's going to determine if you get 10, 20, 50, 100% for a disability. So you got to keep that in mind when you're submitting these claims, especially right now for Pact Act related claims. Sinusitis and rhinitis is one of those two claims, as well as asthma, bronchitis, a couple other things that are Pact Act presumptive claims. However, if you don't have a diagnosis, you don't have any complaints, anything like that, the VA, they're still going to deny you. They may verify that, yes, you've been exposed, because whenever you put in your claim, it opens up that door. So that's just one thing that they don't have to worry about once you submit that supplemental. It's like, okay, go out, get an actual diagnosis if you're having issues with your sinus or, rhinitis or anything like that. Go out, get an issue, get a diagnosis. because one of the main things that the VA is denying Pact Act related claims for is a lack of diagnosis, a lack of treatment history, and no in-service complaints. So if you don't have in-service complaints, you gotta establish personal statement and buddy statements, or possibly a nexus letter. That's worst case. Best case, as long as you know how to write, you got a mind. Everyone got a mind. You'd be good. Give it to the wife, friend, buddy who's an English literature major, whatever the hell. Let them review it. Let them see it. And you want to, I got videos on, I talk a lot about the personal statement, because the personal statement is very powerful. Now, once you get into it, hey, we can make things happen. But until next time, if y'all like this type of content, y'all know what to do. Until next time, this is D-Bo. Salute!